Hi, my name is Katie Tullis, and I'm here to talk about case study 2 for Special Education 683, Section 811, with Dr. Henderson. This is in fall semester 2024. So, the objective of this case study is to identify, define, and describe an intervention used for specific behavioral targets. We will also discuss the functional relevance of the intervention and evaluate whether it is evidence-based. So a quick overview, we're going to cover the behavioral targets, intervention description, intervention procedures, functional relevance, evidence-based practice, the rationale, and integration with the BACB task list items. So behavioral target identification. I chose 4. I'll only really be talking about one, but I wanted to choose 4. So I have emits 10 independent mans per hour, selects items in an array of 4 for 20 different items, with a focus on his reinforcers, imitates 10 different speech sounds, and finally engages in parallel play with brother for a duration of 2 minutes or more. So the intervention description. So the target behavior emits 10 independent mans per hour across 2 settings, 2 therapists, and for 5 consecutive days. And then the intervention strategies we'll use are functional communication training, FCT for short, tact to man transfers, while attempting to identify his vocal profile based on Patrick McGreevy's work. And this outlined in Essentials for Living. So intervention procedures. So during the antecedent strategies, we'll be assessing motivation with different items that he's playing with. We'll heavily label items during play, and we'll increase opportunities for mans to occur. So, we're eating a snack and he's eating a lot of crackers. We'll say cracker, cracker, cracker. And then we'll put a couple on his plate and then he finishes those and then we can hold up a bag of crackers and then like a bag of goldfish. So we ask him which one he wants and then he points to crackers. So then we say, um, we, go to put some down, we pause and there'll be a moment where we give him a chance to mand. If he doesn't mand, then we'll just, give the prompt and do a coic trans attack. We're labeling, we're labeling, but we're using echoics. So it's this tact, echoic, and then mand procedure that we'll be using. Um, and then the behavioral technique. So we're definitely going to be creating deprivation by removing or blocking access to items before he has an opportunity to go in and get the item himself. And then we'll pause for client attempt to mand. And when that doesn't happen, we immediately prompt and we accept the best attempt out of 3. Because of his apraxia, it is not always clear, and they will not be consistently clear. So we have to account for this by giving him those 3 attempts to make the clearest one. Usually on the 3rd one, it is the clearest. So it's a good practice of the echoic, and also providing multiple opportunities to say it before getting the item. So the consequence strategies will use differential reinforcement when delivering reinforcement. So if it's really clear on the first time and if it's, one prompt, we're going to give a little bit more. But if it's completely independent, he can have like 5 crackers versus 1 or 3 crackers. This can be used with a lot of different items. Crackers is just kind of like an easy way to do that, and explain this for the purposes of this explanation of the case study. Um, so functional relevance, shaping and the differential reinforcement allows us to increase intelligibility while also targeting independence with a apraxia while deciding which method is best. So this client does not have a consistent mode of communication, which is a problem at his age, and he does not have the skills necessary to have sign or the AAC devices under control. So he has the longest history with speech, so that's where we're going to continue to go with, while using some fine motor imitation, gross motor imitation, and selecting an items of array so that we can build up those skills to test to see whether AAC or sign language may be a better mode of communication for him. Um, the man to tack transfers increase opportunities to contact models. It allows us to give multiple chances to hear it so that the more he hears it, he's more likely to mand independently. So this functional communication training teaches appropriate replacement, which is demanding or requesting for the problem behavior. Functional communication training is heavily researched and has shown positive results for increasing mands while decreasing problem behaviors. And then shaping is also recommended by Dr. McGravy, and differential reinforcement is an ABA practice for delivering reinforcement. Um, and finally, mand attack transfers are also heavily researched and proven by Dr. McGravy to increase independent request. All of these things are pretty heavily used within the ABA community and are known as evidence-based practices. So this wasn't this this made this pretty easy developing this intervention. Excuse me, intervention for him. So, rationale. First off, this client does not have a consistent mode of communication, as I said earlier, nor enough skills to identify which one is best. And it is really important that we get him communicating his wants and needs as soon as possible. So, manding should be the first goal we're targeting here, but some of my other goals that I built in, like the responding in array, will help us kind of decide that. And then starting with vocal because of his longest history, and then build up and hopefully, test whether ASL or ACC is more appropriate for him because he does have apraxia. So his speech is not, he's not performing them with adult pronunciations, so he may not be intelligible to others um, outside of speech therapy and the home. Integration with the BACB task list. So, state intervention goals. I selected 4 intervention goals to increase skills needed for a variety of communication modes, vocal, ACC, and ASL. Identify potential interventions. I identified several intervention procedures that can be used in tandem to increase manding and independence. Recommend intervention goals. Indicated the need for consistent communication and created intervention goals that allow us to determine that. The ACB task list items continued. We have select alternative behaviors. So manning is the alternative behavior for a lot of his maladaptive behaviors because he cannot communicate his needs right now. We can plan for possible unwanted effects. Um, I'm doing this by admitting that vocal may not be the best method, so trying to build up other skills to use another mode of communication for him is kind of planning for the unwanted effects and possibly not being a successful way to communicate his needs. And then monitor client progress. We'll monitor client progress through graphs and behavior data collection in session. Also consider when to probe other communication modes based on some of the other, as he masters out some of these skills. Determine when to use consent versus assent. So this client delivers a lot of precursors for when he is overstimulated, and I prop space when I see them to provide him with a break. He is very clear when he needs some time, and he has long sessions. We usually do 4 3.5 hour sessions together. So like I allow him some time, but I also want to provide that time while using some functional communication training by getting to him before he has the problematic behavior. Um, Apply culturally sensitive interventions. So this is a multilingual home. AAC may be a better option because it provides pictures for grandparents who speak little English and also flexibility in language output. So I could see this possibly being changed to, I'm not sure what the family speaks. So I don't want to misspeak on that. But let's say they travel outside of the country and need to change it. This might be a little confusing for the client, but they could perform this in another language versus in English. So it gives a lot more flexibility because of that. And that is all that I have for today. Thank you, and I hope you have a good evening.